Hi everyone, I'm Mark Ross, I'm Myprotein ambassador, and I'm going to teach you in this video how to use a foam roller to improve tightness and mobility in the lower body. So first of all, I'm going to go down to the floor. So if you want to position yourself onto the floor, you might have extreme tightness in one calf, you might have a certain calf that's tighter than the rest. What I'm going to do is show you the easy version and the harder version for all these exercises, okay? So all you're going to do is rest your calf, rest the weight. From there, you're going to put the weight onto your hands and you're going to control your body through the foam roller, okay? So a lot of people don't know how to use these and they look a bit tricky sat in the corner of the gym, but what you need to do is start to use it, get more confident with it, and start to push your muscles through a bit of tension to relieve any tightness, a few knots, and to release a little bit of fascia, okay? So I'm doing the easy version at the moment. So it's a double calf foam roller, right? But a lot of people have got either relaxed calves or tight calves. So for that, I want you to place one foot on top of the other, and then what you're gonna do is pick a little bit of your muscle and you're gonna do a small roll over it, okay? So you don't need to do a long, full muscle roll. It's just slowly finding where it hurts the most on you and putting a little bit of pressure on there for about 10 to 15 seconds, and then find another area and you're going to move on to that spot. So on this one, a lot of people are tight in the top of the calf. So in that position, you can twist over and you can apply some more pressure to it. Down to the lower part of the calf, you've got kind of your tendons behind your ankle, but it's more the top of the calf where most people are sore in this position, okay? So you do 30 seconds around about on one, and then you're going to change over to the next one, and you're going to do 30 seconds on the opposite side. As I said, you're going to rotate your muscle inside to outside. You're going to find the part where it's really sore, and even though you don't want to push on that part, just dig in a little few seconds on there, nice and slow as I'm doing. Put some weight onto your hands. It'll take about 10 to 12 reps. That's usually 30 seconds. If you don't want to count time, you can just do 10 to 12 slow reps, and then that should loosen your calves up on there, okay? So from the lower part of your legs, we're going to move up, and we're going to do the IT band, which people have heard about. You might have heard about. It's a really tight bit of fascia, which basically is, in layman's terms, just a wire that runs from your kneecap all the way to your hip, okay? So this fascia gets really tight if you ever sit down, which most of the population are these days, sat in a classroom, sat in a car, driving all day long, and your body basically gets stuck in that position there. So when you do try and lift, when you do try and do any weight training, that's super tight. Your back might feel the tightness in there, and your knee especially might feel a bit of pain when squatting or lunging, okay? So what we're gonna do is turn our body weight onto the side. I'm gonna do the easier version to start off with. What you're gonna do is place one foot in front of the other, so you're relieving the pain, you're relieving some tension on that leg. You're dropping down to your elbow, so all my body weight now on the side of my thigh is on the foam roller, and the same thing again. All we're gonna do is slowly, on this one, roll up and down. So especially on this IT foam roll, you get a lot of pain because most of the population, as I said, are super tight in this area. What it will do as well is pull your kneecap the wrong way. So if you've got pain while squatting, whilst lunging, as I said, this will help before you start to train. It's basically putting your kneecap back in the position it should be. Everyone's super tight on the outside and weak on the inside, so we're going to go through that a little bit later on. But as I said in the calf video, it's 10 to 12 reps on the area that you know you're tight in. So for me, it's right at the top of the hip, right up there. I've got a lot of pain at the moment, but at the same time, you can come down just near your kneecap and twist over it, turn, and you will find somewhere that's tough for you, and just find that area and put some pressure on. Now, the harder version of this is to place one foot on top of the next one. It's a little bit more balanced, but some people might not be tight. We've got kind of a soft foam roller now, and you can also get a hard one. So you've got to judge, you've got to test it yourself, but if you have a really soft one, you might be able to do this one, which is just advanced, but the same thing, it's just releasing that tightness in the side of your thighs from there, okay? So you would do 30 seconds on one, and then you change over to the side, but for the sake of this video, all I'm gonna do is move on to the next body part. Okay, so for this one, it's going to be the front of your legs now. So we've done your calves so far, the side of your IT band. We're going to do your quads. Now, your quads is a big muscle. It's made up of a lot of different muscles. But what I'm going to focus on is imagine your pocket area. You're going to be foam rolling your pocket area because people are tight in the hips, or they think they are. It's actually your top of your quad that's pulling on your hips, okay? So I'm going to foam roll that part, which should loosen things off up here, and it should give you a much more relaxed lower back, all right? So I'm going to start with both thighs on, elbows down, and I'm going to slowly try and find the area that I know that I'm tight in. Some people are different, some people are tight lower down. As I said, my top of the quad, from squatting, from running and playing sports, it's more the hip area for me. So all I'm going to do is twist onto my pocket. From that side, as you can see, I'm going to turn around in a second just so you can see this side. It's the side to the top of my quad, and it's quite painful, but I'm just going to dig deep. You've got to breathe through the foam roll. You've got to really breathe deep. Don't hold your breath, and just try and relieve that pain. After about 7 or 8 slow rolls, it will subside, and you should feel a little bit less pain from there. All right, I'm going to turn to this side now. So 10 to 12 reps, same thing. I'm not fully on my side. It's the top of my quad, and you're just trying to relieve that tension for 30 seconds. Again, pain starting to go a little bit now, and this should really increase the depth in your squat. So if you can't squat very deep, a lot of people are tight in the hips. Remember, it's just below your hips, it's your muscle, it's your quads, all right? So from that position, we've done your calves and your IT band, and we've done your quads. Now we're gonna go to the backside and the posterior chain, which is another reason people have bad posture and they really can't get that full squat and that full hip thrust when you're standing tall, okay? So I'm gonna turn around now. Okay, so on the posterior, we've got your hamstrings, we've got your glutes, your bum, and we've got your lower back, okay? These 3 things are a huge part in the fitness industry where guys are tight, girls are tight, and as I said, sat down all day long. We really need to relax these muscles, okay? We need to get them firing as well, but we need to stretch them out first because people are so tight in them areas, okay? So we'll start on your hamstrings. For me, it's not a really tight area. I try and take care of them, but at the same time, I've had clients, I've had friends who do this one, and they have got desk jobs, and they struggle with pain from here. So it's similar to your calves. You can start with a double foam roll, and then what you can do is, if there's not a lot of pain or you can't really feel much, just increase the load onto one leg there. Okay, so you're going to go full muscle roll, but obviously if you feel a certain area, you're only going to go over that area again. So a few inches up and down for 10 to 12 reps, and then you can change legs. Okay, so as I said, I'm okay with my hamstrings, so I don't really need to work on that. You don't need to do the full kind of lower body. If you aren't tight in areas, then just move on to the next body part. Okay, so I'm going to go glutes. On this one, it's a little bit tricky, okay? So obviously, we're talking about your bum now. You've got 2 cheeks. You need to figure out which one you're gonna work first of all, and you're gonna rotate onto that side, okay? So what I'm gonna do is my right side of my body, I'm gonna bend my right leg, okay? So once I do bend my right leg, I can really get a full stretch in the right side of my glutes, okay? This one gets everyone, okay? Because no matter what kind of lifestyle you live, we will sit down quite a lot, we will drive quite a lot, and everyone will want to squat, or they should want to squat, should want to do some kind of athletic sport, lunging, okay? Lunging, cycling. So we need to release this area. What we're gonna do is slowly, again, up and down the foam roll. You will find an area, whether it's the top or the bottom, and go over it until that pain starts to subside. You can twist in, as you see I'm doing a bit of a circular motion now, and I'm turning into it. And for me, it's the top of the glutes. It's right, the strip at the top of the glutes, which attached to your lower back, okay? It's called your piriformis, but it's, you don't need to worry about the names. It's a strip of muscle that runs up your glutes. And if you do loosen this area off, lower back pain will get a lot better. One that my clients use a lot before they train with me, I make them do this one. because I'll always be hitting the legs in the sessions, and they'll have been sit down all day, or at least they've been driving to the gym. So from there, change to the other side. I'm not going to do too much on this side, it's more my right hand side, but as you can see from there, my holding leg is bent but on the floor, and then my left hand side is twisted, and you can get a full range on that left, okay? And last little bit on the posterior, so you've done your hamstrings, you've done your glutes. The last little bit, still involved with the lower body because it does help a lot of lower body exercises, your lower back, okay? So you've got the lower back, you've got two strips of muscle at either side of the spine, and all we're gonna do is similar to the glutes, you're not gonna to it, you're gonna slightly twist, so you're gonna twist on your right hand side, and from there, you're gonna go down, top of your glutes, and then middle of your back. As I said, we're staying lower body. This one will feel a little bit like you're winded, like it's pushing into your spine, but it's just your erector spinae, it's just your muscle next door to your spine. It's a little bit tight, but trust me, this really relieves it. If you do this foam rolling routine 2-3 times a week, you'll feel so much more mobile and flexible before you do your lower body sessions, okay? So obviously I'm twisted now. I've done about 10 or 12 reps. Then you would repeat that on your left-hand side, okay? So just to recap, we've done calves, we've done your IT band, we've done your quads, we've then gone on to your posterior, we've done your hamstrings, your glutes, and the top of your bum, okay, with your lower back. So guys, hope you've enjoyed that. That's the foam rolling routine. As I said, 2 to 3 times per week. It'll improve flexibility and mobility and make you train harder in the gym, okay? Thanks a lot, see you soon.